Now the next approach to the acoustic neuroma would be the retrosigmoid approach. The features of this approach are, here we can preserve both hearing and the facial nerve. The indications of this approach are for revision surgery, tumors involving the lower CP angle and the internal auditory canal, and for larger tumors more than 3 centimeter. So the contraindication here would be tumors extending laterally for more than 2 centimeters. Coming to the surgical steps, we start with a complete mastoidectomy. Then we expose the sigmoid both in front and behind. We then compress the sigmoid to get better exposure and improving the access. Then the posterior fossa dura is incised. Cerebellum is retracted posteriorly. Then the bone of the posterior aspect of the internal auditory canal is removed. The anterior inferior cerebellar artery is identified and preserved. Facial and cochlear nerves are also preserved. Tumor is then dissected out. Dura is closed and the mastoid obliterated. Now coming to the last approach, we have the middle cranial fossa approach. The features of this approach are, again here we preserve both hearing and the facial. The indications are small intracanalicular tumors, and in terms of size less than 1 centimeter. Contraindications would be tumors more than 2 centimeters in size and tumors involving CP angle. Now lastly we come to the surgical steps. We start with the craniotomy. A window is made in the squamous temporal above the floor of MCF, middle cranial fossa. Then we elevate the dura. We need to identify landmarks. The anterior landmarks are the greater superficial petrosal nerve and the middle meningeal artery. Posterior landmark is the arcuate eminence. Now after we identify the landmarks, then we need to expose the fundus of the internal auditory canal. How do we do that? We need to identify the angle between the GSPN and the arcuate eminence. And then let's say there is a bisector drawn to this angle. So if we drill in the area of the bisector, then we will be able to expose the fundus of the internal auditory canal. After this, the tumor is removed. And then fascia and fat are used to close the defect. So that is all about the approaches to the acoustic neuroma. Thank you guys for watching. Please do like, share and subscribe. Have a wonderful day, people.